Hello and welcome to our video tutorial on applying the cognitive perspective to health and social care. The aim of this video tutorial is to consider the applications of the cognitive perspective to health and social care. By the end of this video tutorial, hopefully you'll be able to explain how the cognitive perspective can be used to support individuals with learning difficulties, how the cognitive perspective can be used to support individuals with emotional problems. You'll be able to discuss how the cognitive perspective can be used to support individuals with depression, and also how the cognitive perspective can be used to support individuals with post-traumatic stress disorder. Individuals with learning difficulties can experience enormous frustration in their daily lives as they seek to make sense of what can be a bewildering experiences. The cognitive approach can be used to help people who misread situations. By identifying irrational thoughts, an individual can be guided to change them, with consequent benefits for their emotions and their behaviour. Cognitive work of this variety can be used to improve self-esteem and reduce outbursts, which may be triggered by a lack of understanding of the requirements of a given situation. For example, having to wait their turn for a meal. The cognitive perspective is widely used with individuals with a wide variety of emotional problems. This perspective begins by examining how distorted and irrational negative thoughts influence feelings, which then lead to changes in behaviour. The psychologist Beck formulated a helpful approach to understanding depression known as cognitive behavioural therapy, or CBT for short. The pattern is described by Beck as a cognitive triad. To begin with, the individual thinks he is worthless and inadequate. This self-appraisal then leads to the belief that this lack of worth means that the future will be just as bad as the present. This then generalizes to a conviction that the world contains problems and difficulties that the individual is powerless to overcome. The goal of cognitive behavioural therapy is to challenge these negative thoughts and encourage the patient to develop alternative, more positive ways of seeing the world. Post-traumatic stress disorder consists of a set of symptoms such as re-experiencing traumatic events, avoiding stimuli associated with a traumatic event, and problems sleeping or with hypervigilance. Post-traumatic stress disorder is commonly experienced by soldiers, but is also experienced by others who have undergone traumatic experiences, such as rape. The treatment of post-traumatic stress disorder usually involves a healthcare practitioner, such as a psychiatrist, psychiatric social worker, or clinical psychologist, working with an individual to help them reframe their thoughts. The aim would be to recognise that the feared events have actually happened and are not reoccurring, so that the constant mulling over of trauma will disappear. Alongside this, usually there would be a need for some treatment involving behavioural therapy, and this might be accomplished by an outreach worker or a home carer, helping the individual to face feared situations. By confronting their feared situations and learning that they are not going to suffer as they did originally, the psychological effects of fear, panic and anxiety will diminish until the individual is eventually able to lead a normal life.